Hello, testing to see whether or not this is working. I'm doing a quick check here to see whether or not we're actually having any sort of engagement. Are people actually responding? Okay, seeing whether or not anything's popping up on my own Facebook to see. Okay, so it shows that I'm live here. Responding. Okay, so it looks like some people. All right, and as normal, what I shall do is while people start logging in, I am going to start sharing this link in the other groups in order for us to have some semblance of a united front when it comes to dealing with this. So one of the hotel groups is not as politically focused as we are, and so I won't be sharing it to those guys, but I will be sharing it to a group called the GAA Hotel Group, and those guys are willing to talk about the campaign and how we can move forward in order to achieve our goals. So eventually, if one of you guys are willing, I could use some help during this moment of starting the lives, of actually sharing the live to the other groups. That way, I won't have to spend the first couple minutes actually copying and pasting it. So let me write here. Faces of Advocacy are doing a live briefing to discuss the strategy to focus on provinces and to get borders open, or borders less restricted, I'll say. I'd use very careful language because this has become quite challenging. Looks like there are 32 of you there right now, so thank you very much. If you have anywhere you want to share this to, I'm happy for you to share it. We'll have question and answers afterwards. By the way, the reason I'm not wearing my typical green shirt is because it's in the wash. You might be wondering, why does he not wear a different collared shirt? And if you look back at every single video I've done, you'll see that I wear one green shirt. Why? I don't know. I like how it looks. My girlfriend bought it for me. It's nice. Okay, let's get it to the aviation people. So if you are a aviation worker who's had struggles due to the COVID-19 travel restrictions affecting your job market, there is a good group called Aviation Workers made redundant by the COVID-19 crisis. I am not familiar with how aviation works, but I understand that there have been a significant number of challenges. I gave a shout out to your group. Okay. All right. And then please share it along to any of the other groups that you have over there. All right. Now let me check to see as long as the streaming is working. Okay. So it's working here. Saying hello to our team member in the chat, who is Sydney Manton. I have yet to give her a proper title. So today she shall be Director of Ensuring that Lives Are Working. Okay, all right. Yes, Damiano, that is the group that is mostly, I feel maybe they aren't quite interested in the campaign to change things. Their focus is on something different, which is A-okay, because they've helped a lot of people in that regard. Okay. So please put your questions in the chat if you have any for us to discuss moving forward. All right, so let us begin. So today is an interesting moment because some news came out, and let me do a screen share to the article to actually focus on that. I'm still here, just looking, okay, here we go. So there was an article that came out today that says Canada's premiers disagree about when to reopen the Canada-US border. Now, the Faces of Advocacy are not entirely focused on only one border. We deal with all borders. I myself have a partner in Ireland. Half the team have partners internationally, non-US. But I believe how they handle the US border, it'll be a strong mark of how they handle the other international borders. So what's Legault says is that the premiers are unable to find a consensus on how to treat the opening of the of the borders. Now, this is where I might use some terms interchangeably, but we really have to be quite focused on what we're trying to do. Opening of the border means that there would be no restrictions. And what we want to do is get some progress towards the open border with families at the front. And that is what we'll talk about with the recent scientific recommendations. So in this article, they say there are provinces like Alberta that would like to open quickly, and there are provinces like Ontario and Quebec that want to wait. So for those of you just joining us, the Face of Advocacy is a group of over 11,000 who are directly responsible for the extended family and compassion exemptions into Canada. That was released in October. So what that is your IMM006, the fact that you can have your not unmarried, not common law partner, or your grandparents or your adult children come into Canada, or you can come into Canada if you have a compassionate reason. That was from the work of the Face of Advocacy, alongside so many people who wrote letters and spoke to their MPs. What happened during that time is that there were a few moments when our exemptions were supposed to come in earlier than October the 2nd. During our meetings with the government, we heard a funny little anecdote where a premier with a name that is similar to a car company was blocking us. So it sounded like other provinces were okay with the extended family and the compassion exemptions occurring. But at the time, one particular premier of one particular province was stopping that from occurring. So while the borders are it's seemingly a federal jurisdiction, there are some legal arguments about whether or not that's solely the federal, but whether at the moment it appears that the border controls are a federal jurisdiction, they still need the buy-in from the provinces. And so if we have some provinces like Quebec and Ontario against any change of border control, including adopting the scientific evidence and recommendations that the federal government has suggested, we are going to have some trouble. So this week, we're going to have to pivot and hit the provinces a lot harder, but at least we have a clearer picture of where we want to go. The basic rationale, according to this article, is that Quebec wants the people to have 2 doses of COVID-vaccine before reopening the border. Their argument there is that having the full dose, the full protection is better before reopening. So I realize this is very disheartening, but a full reopening of the border is still very different than the kind of stepwise approach that we want to take at the Faces of Advocacy, and that includes putting families first and the adoption of a stepwise border control measure that was suggested by the scientific research advisory that was released a few days ago. For those of you who are unsure of what that refers to, that is this document, the Priority Strategies to Optimize Testing and Quarantine at Canada's Borders. The basic idea is they say there should be no hotel quarantines. If you are fully vaccinated, you do a test when you arrive, but you don't quarantine. It's just for tracking purposes. If you are partially vaccinated, you arrive, and if you are negative on your arrival test, you don't have to quarantine. And then those who are unvaccinated, when you arrive, you have your testing, and you will still have some level of quarantine. This also, by the way, for those who are partially vaccinated or unvaccinated, you still have to continue with the pre-departure test. But those are the basic recommendations of here. And once again, this was a panel of experts that was commissioned by the Government of Canada to actually give recommendations on the borders. It looks like Minister Haidu and Dr. Tam and the other ministers have chosen not to act on this, and Minister Haidu has said that they want to talk to the provinces first, which once again brings more credence to the theory that the provinces are who we have to win over right now, because at least the federal government doesn't have much leg to stand on by ignoring their own scientific research. Now, I mean, that could still happen. It's occurred. We have issues with that. But for example, the Deputy Prime Minister has said out front that they want to follow the science. Prime Minister Trudeau has said so as well. So I have a feeling that if we are able to convince the premiers of the provinces and get some provincial support for what we need to do, that can be a key to us getting what we want. So in our next version of the advocacy letter, we will be having the premiers there, and then you'll have to write not only to your MP, your member of parliament, but as well as your member of legislative assembly, your MLA, or your MPP, your member of provincial parliament, depending on what province you're in. If you have trouble finding your MP, go to ourcommons.ca. type in members, go find your member of parliament, and then type in your postal code. From there, you'll be able to find out who your member of parliament is. For me, it's actually the Deputy Prime Minister, Chrystia Freeland. It should show up here. Guess it's not, but don't know why the website's not working. Chrystia Freeland, and then you can get your MP's email from there. For your MPP in Ontario, we have a member who created a giant list for us, and we'll be showing that to you guys soon. If you need help finding the advocacy letter, go to facebook.com/facesofadvocacy. Please follow our page for the latest updates. From here, you can find our advocacy letter pinned to the top. Click on our one-click advocacy letter, and that will auto-populate an email. From there, in our later iteration, we'll have the premiers on it. Right now, as the Prime Minister, Health Minister, the Transport Minister. Make sure to add your MP, and then send it from there. So we should talk about the role vaccinations have at a border reopening, and what Trudeau has talked about, and what Prime Minister Trudeau has actually said in implication. So this comes from May the 20th, where Prime Minister Trudeau says over 75% of Canadians may need to vaccinate before Canada-US border reopens. Now, once again, I believe what happens to the US border is probably going to happen to the international non-US border. So please don't take this as we're only focusing on the US. That's not true. We all have, many of us have family outside of the US, including myself. So why is this number important, the 75% of Canadians? So there are some people who will never be able to get vaccinated, either by choice or for medical reasons, but they simply won't. So the value of having a certain number of Canadians vaccinated refers to something called herd immunity. Herd immunity means that if a country has enough people who are immune or vaccinated against a particular disease, that even if the disease shows up, it will not permeate through the rest of the country. So for example, with measles, mumps, rubella, a lot of people are sufficiently vaccinated to measles, mumps, rubella. And so if you have an outbreak, it doesn't necessarily spread across the country. So that's where this item comes from, 75% of Canadians. And I think this is where a big barrier is coming in when it comes to the politicians of the provinces and the federal government. Because the Canadian rollout of vaccinations were slower than what we had hoped. Even if someone is perfectly vaccinated and coming in, any change to the border control might be perceived as allowing people with COVID into the country. Now, the Faces of Advocacy have long positioned themselves to loudly and clearly state that less than 2% of COVID transmissions are due to the incoming people. And we can go through that science maybe a different time. But this is the government's own epidemiologic studies. So that is the only rationale why I'm seeing the 75%, and the best explanation I can give you. It doesn't mean I necessarily agree with it. I'm just trying to explain to you why that's coming in. So if more Canadians are vaccinated, that might make things easier for our own numbers. In terms of if we get vaccinated outside of the country, how does the Government of Canada know? And I contacted Health Canada directly about it with some contacts I have there. And they're working on it, but we've had some success from individuals contacting their family physicians or the Public Health Agency of Canada themselves and letting them know, but I have no idea how that actually is being used. I also am unsure, and I've asked this question, how those who are 12 to 18 are actually being counted, because will this actually be counted as adults for that amount? Okay, so before we go into questions, I just want to talk about a few things. A few days ago, there was a horrific story of 215 children's bodies found at a BC residential school. For those coming into Canada, for those who aren't too familiar with our history, residential schools are an atrocity where the government had taken children who were First Nations, Métis, or Inuit from their families and tried to make them more in line with what the Government of Canada felt was Canadian at the time. This led to horrific abuses such as physical, emotional, and sexual abuse. And the Faces of Advocacy focuses on family reunification. And it occurred to me, seeing these stories, that we have been so focused on bringing our families into Canada, we have forgotten the atrocities that happen to families within Canada. And this is something that we may end up dealing with once we have dealt with our border issues. But I wanted to show some places where maybe you could focus on if you want to do something to help this situation. There's the First Nations Child and Family Caring Society. They take donations. You can help learn a little bit more. Speaking of learning, University of Alberta has a free course you can audit to learn more about the history of Canada. We are a Canadian organization, and the history of the First Nations people of Canada are a significant part of our history and can show a lot of the darkness that has occurred in our country. And I think we should focus on making things better moving forward. All right, so let's go with some questions here. So the U.S.-Canada working group to open the border announced by Biden a few weeks ago from the border. I've worked with the Wilson Center, who I think is actually closely associated with that working group. And I know that the Wilson Center has long said that there are ways to open up the border safely. So as far as I can tell, on the Canadian side, the federal government has a lot of say when it comes to the border, but they do take the province's word quite heavily. I remember now, just before October 2nd, exemptions, in speaking with the high-level government officials at the IRCC, Immigration, Refugees, and Citizenship of Canada, they were telling us how we should focus on Ontario, which, combined with the premier whose name sounds like a car company, heavily seem to imply that Ford, heavily seemed to imply that the premier whose name sounded like a car company was staunchly against the changes. So I cannot tell you what the working group, what barriers the working group is going through, but I do know the working group has made a lot of the working group that I worked with, the Wilson Center, has a lot of recommendations in allowing business to restart over the border. And I think the pushback is coming politically. That's why the Faces of Advocacy and all of us need to focus on our provincial leaders, our federal leaders, and changing the public perception. I think we're in a better place than we were before, but we still have a lot to do, and we need to increase engagement. Huh. First time we have spam in the chat. That's kind of cool. Yeah, I'm growing a little bit. So, I mean, there were a number of pilots that were essentially tossed aside. There was an Alberta pilot, there was an Ontario pilot. They showed that, post-arrival testing was very helpful. It showed how low the COVID transmission was. This is a big battle that we have to win politically and in the public eye. Much like last year, I'm not entirely sure if the science, which already backs us, is the only battle we need to win. And that's where engagement and moving forward, or in an organized fashion with sending your advocacy letters, is probably the way that we're going to enact some change. There is implication that one particular province's government is blaming travelers to hide their own mistakes in handling COVID within that province. The implication has been that Premier Ford has been pointing at travelers instead of seeing the number of problems that have occurred under his leadership. That's a working theory. I don't know if that's true or not. The airlines and other than travel industry has really started to put pressure, from my understanding. And if any of you guys are here from the aviation group, please feel free to contact me if you have ways that we can work together. I'm at poon@facesofadvocacy.com, poon@facesofadvocacy.com. I have spoken with the IATA specifically about it. The problem with this working together is, from my understanding, family reunification is not a large enough sum to save the aviation industry. So what we need is a partner, a champion there who can really work with us, because there are things about the airline industry that I simply don't know. And as much as I want to help and move forward with it, all I know is family reunification. And that is not enough to save the airline industry. So I've contacted IATA again since the recent report came out, and I'm waiting for their response. I'd like to talk about vaccinations. So there have been some questions about whether or not the vaccines have been tested properly. So I rarely talk about this part of my life because I have tried to keep my professional day job separate from the advocacy. But I've recently spoken to my bosses and some of my mentors, and it looks like blurring that part of my life and the advocacy work is okay. So I'm a family physician. I just completed my master's in public health in New York at Columbia, and I'm also what's called a resident in public health and preventive medicine. So the easiest way to explain it is I'm being trained to become a medical officer of health. It's not medical officer of health school, but a lot of us end up becoming a medical officer of health. And so I speak to you with, of course, not the top level experts level of vaccines, but I speak to you with what I have been taught. And the vaccine is safe. The reason it came out so fast is a hugely disproportionate amount of money was invested into making the vaccine safe. And that meant trials and trials and trials again to ensure its safety in an accelerated fashion. So an outside observer might go, whoa, how could they make this happen in a year? This can't be safe. And I beg of you to please reconsider that it is safe because of the abnormally high level of investment that have come into the research of this vaccine. So anyone watching here, I understand you might have concerns. Please speak to your family doctor. Please speak to maybe someone that you trust who is knowledgeable on this subject and has been trained in this subject. Not just anyone, but someone who's trained in the subject, like those in public health. And I hope that can abate your concerns that the vaccination is unsafe. But the vaccine is safe. I myself have been vaccinated. Many celebrities have been vaccinated. Our prime minister has been vaccinated with AstraZeneca. I strongly believe in mask mandates, in safe border controls, and I do believe that the science behind the vaccine has been safe and COVID does present a danger. I cannot make that more clear. Okay, I don't know what the Air Canada news is today. So if someone could send that to me, I don't know what that is today. Yeah, most Canadians don't need to travel or work for family reunification, so they might be annoyed that they cannot get out of Canada for a vacation. So we're focusing on the fact that we have a giant piece of the puzzle given to us, which is the scientific recommendations that was given by the federal government. And so that is a fantastic wedge issue for us. We aren't saying this time, oh, please help us, we're a minority. We're saying the government says they'll follow the science. This is the science and you aren't following it. This gives us an incredible level of latitude. Am I live on YouTube? No, I'm live on Facebook Live, and then I bring this up to YouTube. If there's another way to do it simultaneously, I'd be happy to, but this is so far how it's been working. Congratulations on getting your second jab today, June. Lots of discussion on the Premier of Ontario. Congratulations, Damiano, for getting your vaccination. The wait time for the second shot is outrageous. I believe that was done from a supply issue perspective. So for those who are unfamiliar, for example, with Pfizer, you're supposed to get the second shot within a month. The government of Canada decided, not with the blessing of Pfizer, that you could take a little bit longer to get your second shot. It is from my understanding that that delay in getting your second shot will still offer you a very good immunity until you get your second shot, and your second shot will still give you a strong level of boost to have the very strong immunity. This was probably done out of a necessity from a lack of vaccine, and it did give a lot of people their first shot. I cannot comment on that because that would either breach me in my professional life or speak ill of getting vaccine. But the basic idea is if you can get a shot, get your shot. I think there's a Twitter group called Vaccine Hunters or something that can help you get your shot. So please try to get your shot if you can. Remind your friends and family to report their vaccinations to the health units where records are kept. Okay, good. Thank you for your work towards supporting our cause. My fiance's PR was approved and due in March. He still hasn't received it. Any idea on those delays? So for those of you having PR issues, if you look at the Face of Advocacy group, type in the word mandamus, you'll find a lot of work that we did to help people with a legal option that allowed their PR applications to be processed. That doesn't mean approved or denied, it just means processed. Sorry, it doesn't mean approved, it means a process, so you could have been denied. It sounds like in your case, the PR was approved, but nothing has come through it. I'm not too sure, but this reminds me to talk about the IMM 006 and why there are delays. So I spoke again to the IRCC today, and they believe that because the summer is coming up, there are more applications, which is why there's a delay. But what I can say is that we find that unacceptable to have that further delay, and we need some clarification on that. So we're trying to get that fixed. Yeah, I don't know what happened with Air Canada. So there's been talk about the border vaccination areas between the US and Canada. And I'm unsure why Canada is being so hard on people being allowed to vaccinate out of the country. If someone there is an expert, I'm happy to work with you on something. I'm just not an expert on where those border vaccination claims are coming from. And right now we need to focus on getting the scientific recommendations approved. Like that is number one, what we need to do. So if you need to contact me at poon@facesofadvocacy.com, poon@facesofadvocacy.com. Sure, I can check out restream.io. Right now I'm a simple man using a simple streaming service. If masks work, then why aren't these masks used when removing asbestos, including N95? So I feel like we're having more discussion on masks. The reason why I want to deal with this directly is I so strongly believe in masks. So cloth masks are not perfect, but they're better than nothing. And also, when it comes to dealing with aerosolized droplets or sneezes, you know, like or breathing, that sort of thing, these masks are helpful. So N95s are important masks when dealing with transmission of other particulate matter that is, and this might confuse people, but there's a true airborne, okay? True airborne are like tuberculosis. Tuberculosis is if you hang out in a theater and you sit in the front row and some guy with tuberculosis sits in the back row, you sit in there long enough, you can actually get tuberculosis. That's different than the distance issue with COVID. That's different than other diseases. Now, when people refer to COVID as airborne, it's not quite the same airborne as tuberculosis, but we're dealing into technical stuff. I can only say that masks work at preventing a lot of droplets, and they are helpful. But of course, cloth masks that we buy in the street are not nearly as good as the N95, but they still help. And that's the best answer I can give you. So I once again say that vaccines and masks are very important in fighting COVID, which is very dangerous. I need that to be very clear. So, I mean, Detroit has offered Windsor residents to get vaccines, but if you have to quarantine on the way back, that's really difficult for a lot of people, and that's something that we want to be dealing with. Are children being seen as spreaders? Children follow the same protocol as what the adults do, and right now the adults have to, when they fly in, go to a quarantine hotel or quarantine for 14 days if they go in through the land border, so children have to go through the same thing. There are, however, custody exemptions that you have to look into because custody is not my forte, but there are custody exemptions. In South Carolina, it was a difficult booking initially. Our chief of staff, Justin Daly, tells me that the Air Canada gave out 10 million in bonuses to CEOs. I don't know if that will affect. I don't know what to do with that information, but that might affect perception of the airline industry. I'm not too sure, but we need to focus on getting the scientific panel recommendation approved. It's very clear for us. This is what we need to get done. So there might be a lot of noise around, but we need to convince the provinces, our MPPs, our MLAs, our MPs, and the federal government. That's what we need to focus on. That's our clear focus. Okay, so As we move forward, if you would like to help the campaign and you have ideas, please post in the Facebook group because we love different ideas. I've been saying that we're more like a federation. We all work on different ideas and we fly together, those faces of advocacy, to make change occur. If you want to help the campaign, you can go to buymeacoffee.com/facesofadvocacy. If you cannot donate or don't want to, that's a-okay. It's just sometimes I get this question. So buymeacoffee.com/facesofadvocacy. If you are new to us, I ask you, please, if you can like our social media, follow us on social media. That's Twitter, Instagram, Facebook, LinkedIn, and YouTube at Faces of Advocacy, at Faces of Advocacy. This is not for self-promotion or for vanity. It's because we need to be able to show the government that we have more numbers and are a larger voting bloc. This type of thing is helpful because we consolidate. And I think that's the reason why we were effective, is because we worked together to make a change. There are other countries that don't have an organized campaign like the Faces of Advocacy. And I am so grateful that we have all worked together and we all have a wonderful team. Okay, someone joined late. I'm worried that we are taking a hit to prevent vacation travel. I have an idea for getting people outside the group involved. Send to Facebook in a post. That sounds wonderful. You can also please email me, poon@facesofadvocacy.com, poon@facesofadvocacy.com. Because what we need is more people writing letters. So if you have time today, please go into another group, comment under someone else's issue. There are a lot of news articles right now where people just debate the border. I ask you to go in there and talk about getting them into the Faces of Advocacy so we can get more letters sent. I realize it's a lot easier to complain and vent, and I understand that. But if we want to make change, we need to have action. So please today, you guys in the live, anyone who sees this later on in the recording, please go under a recent news article, see people talk about the border, tell them the Faces of Advocacy are focusing on ending the quarantine hotels and reopening the border in a safe manner, uniting families together. These are things that hopefully they'll come to our Facebook page, follow, and then send a letter. That's the basic idea. Yeah, Debbie, you're right. You can get your friends to send, friends and family, and shout out to Debbie, who's been with us since nearly day one. So I'm very, very impressed with that. If I could make one comment, I had a conversation with MP's offices and they are overwhelmed with emails. In particular, it is effective to only mail your MP in your riding. That's correct. We are only mailing our MP in our riding for the federal government, but we also have to email our MPP, a provincial member of provincial parliament, or our MLA, our member of legislative assembly, depending on what provinces you're in. And then we have a CC to the Prime Minister, the Health Minister, the Transport Minister. But yeah, do not flood all of the MPs across the country. So a lot of people are new to the Faces of Advocacy. We've done a lot of work, and I just want to highlight maybe some, because some of you will feel that, oh, what good is it that we're doing? What is our level of impact? You know, why do we even bother doing anything? So I want to talk about Sarah Campbell. She is a young Canadian woman with cancer who has a UK fiance. They're now married, but who had a UK fiance, and the UK fiance wasn't allowed to come in and take care of her. She got chemotherapy. She hand wrote a number of letters to the Minister of Immigration at the time. She was a very high profile person that we put up with the Faces of Advocacy. She was mentioned in the House of Commons multiple times, along with the Faces of Advocacy. And this is one person. You are one person too. Sending your emails makes an impact. I realize right now you're feeling like you're voiceless, but you are not, particularly when we're all working together. We have people in the government working for us. This is Raquel Dancho, who was the shadow minister for immigration. And there are many people within government who are sympathetic to our cause. So I beg of you, please do not give up. Please send your advocacy letters. Please get people following the Face of Advocacy so we can organize our approach and we will succeed. Thank you very much to all of you. And I don't see anything else in the chat. So I'll be doing these lives probably again at about 6:30 Toronto time, most days of the week. And hopefully my green shirt will have been washed by then. Talk to you soon.